Good day to you. My name is Michelle and I'm here to share with you information with regards to dementia as well as persons with dementia.
By the year 2030, there will be 80,000 persons living with dementia in Singapore.
Dementia is an illness that affects the brain. It is important to note that dementia is not part of aging, although increasing age is definitely a risk factor.
Dementia will affect a person in many ways. A person may find it difficult to remember new information or recall recent events. At times, they may also find it difficult to learn new information and skills. Loved ones may lose the ability to solve problems and the capacity to make decisions. As the disease progresses, they may lose the ability for self-care. Some persons with dementia may show changes in mood, personality, and behaviors, like becoming increasingly agitated or angry, or be withdrawn or sad. Seeking early assessment is important when one is suspected to have dementia. Timely diagnosis of dementia may help to delay the progression of dementia and help to relieve the symptoms of dementia. There are some medical conditions that may mimic dementia and are potentially treatable. Hence, early assessment by the specialist in dementia is important. Risk factors that increase the risk of getting dementia include physical inactivity, high blood pressure, high cholesterol, diabetes, excessive alcohol consumption, smoking, obesity, lack of mental stimulation, hearing loss, social isolation, and low educational level. You can lower the risk of getting dementia by the following: being physically active and exercising regularly, being socially engaging and participating regularly in a group or community activities, going for regular health screening, keeping your blood pressure at a healthy level, monitoring and keeping healthy blood glucose levels if you are diabetic, eating healthy, nutritious and well-balanced diets with vegetables and protein, quitting smoking and heavy drinking.
Most common types of dementia are Alzheimer's disease and vascular dementia. In Alzheimer's disease, there's degeneration of brain cells in areas that control the memory, thus causing memory problems. The disease presents with gradual loss of memory first, and then slowly progresses to affect other brain functions as the disease progresses. Vascular dementia is often associated with strokes. This is because of the lack of blood supply to the brain, depriving the brain tissues of nutrients and oxygen, causing the death of such brain tissues. There are many other less common types of dementia, such as frontal temporal lobe dementia, Parkinson's disease dementia, and Lewy body dementia. In mild and early stages of dementia, persons with dementia are still able to do their day-to-day activities, such as feeding themselves and going to the toilet. However, they might find it challenging to do certain tasks, such as managing their finances and using a smartphone. They may have more or short-term memory loss, such as forgetting recent conversations that you've had with them, misplacing items around the house, and even getting lost outside the home. They may still have long-term memories, such as significant events that happened in the past, such as birthdays, anniversaries. In the moderate stages of dementia, persons with dementia often require assistance and even reminders in their day-to-day activities, such as eating and drinking, and even going to the toilet. They may not be able to even recognize their loved ones. As the disease progresses to a more severe or advanced stage, persons with dementia are totally dependent on others to care for them and are unable to take care of themselves. They may also not be able to speak or may speak very few or little words.
Persons with dementia may present with behavioral and psychological symptoms of dementia. As dementia progresses, the changes in behavior and mood become more obvious and significant. Here are some examples of such symptoms. Depression. They may feel teary, sad, and are constantly talking about negative thoughts, even to the extent of wanting to die or end their life. They may have problems sleeping at night, may lose interest in their hobbies, and lose appetite and energy. Agitation and aggression. They may have sudden outbursts of anger and scold or shout more. At times, they may even be physically violent, hit, kick, spit, or even bite. Elation or euphoria. They may even be excessively happy, that is out of proportion to day-to-day events. Apathy. They may have little or no emotions and may appear indifferent or less interested in their usual activities or plans. Disinhibition. They may act impulsively, out of their usual character, such as talking to strangers and stripping in public. Hallucinations. They may see, hear, or feel things that are not present. Delusions. They may have false beliefs that are not true, such as people trying to harm or steal from them. Motor disturbances. They may keep doing activities repetitively, such as opening and closing the same door many times, wearing and taking off their clothes multiple times. Sleep disturbances. They may have no or little sleep at night. Instead, they may be sleeping excessively in the morning. This is also known as sleep-wake reversal. Appetite or eating problems. They may lose appetite and not eat well. Some may even have changes in their taste buds and not enjoy foods that they are used to in the past.
Currently, there is no cure for dementia. However, there are medications that can help with memory, mood, function, and behavior. Here are some care tips on how to communicate with persons with dementia.
C. Use clear and short and simple sentences at a slow pace. Use a calm and comforting tone. A. Acknowledge his or her concerns. Be attentive by maintaining good eye contact and spending time with them. R. Be respectful and reassuring. Give the person some time to think and respond in a quieter space and encourage them to do so. E. Engage them to build trust and provide comfort, such as spending time listening to music, doing what he or she likes, and doing their favorite hobbies together.
Taking care of persons with dementia is a long journey and can be very challenging. It is important to take care of yourself as you take care of your loved ones. Here are some tips that may help you as a caregiver.
Exercising improves the mood, sleep, and physical health. Good nutrition. Good quality sleep and rest. Taking turns in the family for caregiving duties or engaging daycare services. Creating personal time or space for a short break from the carer role, also known as respite care. Here are some caregiver support groups.